Okay, this is part 3 of 4 parts about how to reduce the risk of a seizure in patients with epilepsy. And again, it comes out of a friend asked me about, trying to help the son of her friend. So that's why I kind of went through this. And why did I make a claim that I figured out a bunch of stuff about epilepsy? Because all the neurologists are saying is this stuff up here, but there's a lot more stuff that's relevant. And I'm going to show you a bunch of papers supporting what I say. So it's a big expansion over what neurologists say, and it empowers the patient to learn this much more about their neurons so that there's more that they can do than just take a medication. They might still very well need a medication, but they got a better chance now to control their seizures. Plus, even with medications, they often, like about 70% can maybe control it with a med, but at least like about 30% or more, they can't control it that well with the med. And I know there's talk about the ketogenic diet for refractory epilepsy, and there's a little bit of problems with that too, but sometimes that might help. But, it'd be nice if you could do a bunch of healthy stuff, and, maybe you wouldn't need the keto, but there's a good chance you can do it without. I've had a lot of people say they've reduced their risk just by being healthier without, the whole keto stuff, just going low-fat vegan. So let me just talk a little bit more about, what you could do. So here's the different things we talked about. That's the list. You could print screen that if you want. And some other things that came to mind. I talked about the Feingold diet recently, and the Feingold was a way by avoiding food dyes, the artificial food dyes and some of these preservatives, that kids had a dramatic improvement in their behavior. And they thought that this was good also for kids for behavior problems, autism, and some other problems. And it was also helpful to avoid artificial sweeteners like aspartame, Splenda, artificial fragrances. Food dyes are made out of petroleum oil. A lot of them are mitochondria inhibitors too, meaning that they might decrease the ATP production in a neuron, thus decreasing its ability to pump calcium out of the cytoplasm, thus increasing cytoplasm calcium, thus functioning like an excitotoxin. Okay, and notice that, Wikipedia says Feingold diet doesn't work and it's boring. Quite often when something's good, it gets slandered because, big food companies, they're billion-dollar companies. They don't want somebody bad-mouthing their products, because what if people ate less processed food? They would make less money. What were some of the other interesting things about it? They also recommended avoiding preservatives, and I don't have a paper yet on whether or not those affect seizures, but it took longer to make this talk than I thought it was going to. I'll just start showing you some of the papers. Food additives are common causes of attention deficit hyperactivity disorder in kids. So artificial dyes increase ADHD, and they're also mitochondria inhibitor. And that's where I had the idea. I said, well, gee, these artificial dyes are causing attention deficit in these kids. Maybe it's an excitotoxic phenomena. And, I know that you can inhibit mitochondria with these. So if you're dropping your ATP production, then you're also probably going to increase your cytoplasm calcium levels because you can't pump that out. So isn't that all kind of like seizures? This is all kind of variations on the same thing, like a Bach fugue or something. So it would seem to me like these would be ways probably to decrease the seizure risk. So you would want to avoid all this. There can't be anything helpful about this stuff. Artificial dyes and sodium benzoate cause hyperactivity. So by avoiding artificial dyes and sodium benzoate, the kids behave better. This is a randomized control trial. Randomized, double-blinded, placebo-controlled trial. That's as good as it gets. And in 3-year-old children and in 8 to 9-year-old children. So it wasn't just the artificial dyes, the food coloring. It was also sodium benzoate and preservative. So this is useful information. If you want to optimize neuronal function, you want to avoid all these toxic chemicals. Okay, here's another one showing that dietary sensitivities and ADHD symptoms, 35 years of research. ADHD and even not HDA, the kids did better without the artificial food colorings. So even if you don't have ADHD, you're better off avoiding those. Obviously, mitochondrial inhibitors, amongst other problems they can cause. Oligoantigenic, meaning decreasing the number of antigens in the diet. And remember, this guy originally, Feingold, was an allergist, so he's especially interested in things that cause allergies. Some patients benefited also from avoiding, dairy, soy, chocolate, corn. And I wonder sometimes too, what's the reason to avoid corn? Is it maybe just because it's not organic, okay? And then it could have problems related to the atrazine sprayed on it. It could have problems if it's BT corn, Bacillus thuringiens, with chemicals in there that burst the insect belly, and maybe they're going to irritate the gut lining, cause leaky gut, cause other problems related to that. So that was my point. You could even sometimes have it be the problems in the food. There was also problems with soy. I didn't get in this paper what the reason was for that. There's some talk about salicylates, which are related to aspirin, but some foods have a little bit of those as well. And there's some association with that with asthma in some patients, rarely. And again, Feingold was interested in all that stuff. That sort of led to an interest in all these things. This was just a little bit about acute stress is okay. It's normal to have acute stress now and then. That's part of being human. But chronic significant psychological stress is not good for us. And chronic stress can cause some activation of microglia. Those are the macrophages in the brain. And once they're activated, they're sort of sensitized to a subsequent insult, potentially causing them to release toxic chemicals. So you can very easily imagine a person's chronically stressed out, they got insomnia, they're drinking caffeine, all these things increase cortisol and catecholamines, causing some activation of these resting microglia, which by itself, the one thing's probably not that bad, but you superimpose upon that leaky gut, you get the bacterial endotoxins going across the leaky gut, LPS from gram-negative bacteria, lipopolysaccharide, LTA from lipoglycolic acid from gram-positives. You get across the gut barrier. Plus, when you've got leaky gut, you tend to have leaky blood-brain barrier, maybe a shortage of butyrate, short-chain fatty acids due to a shortage of fiber. So now they'll get some access to the brain, which you don't want. You'll always have some baseline access through the circumventricular organs, chemosensors in the brain, but now you'll potentially have more access with breakdown gaps in the blood-brain barrier. And when you get this sort of like two-hit hypothesis, increased activation of microglia, they sometimes sense that as a potential infection. Like, imagine if they bind LPS or LTA. That's reasonable for them to sense that as an infection. And they release these toxic chemicals to sterilize the area, which can, of course, damage normal neurons and lead to memory problems, lead to anxiety, lead to dysphoric feeling. They can turn on their inducible nitric oxide synthase, which is not like nitric oxide in the endothelium, eNOS, endothelial nitric oxide, which is transient puffs of nitric oxide that are healthy, beneficial. This is a chronic, for hours, elevated production and release of nitric oxide, which can form peroxynitrites, can be very toxic to the brain. Not to mention, H2O2, hydrogen peroxide. You can get this reactive oxygen species and oxidative stress damaging brain cells. I mean, it's to sterilize any potential bacteria or anything in that area. So you can imagine it can also destroy neurons. So this is what I'm trying to say is you can get these combination effects that are very damaging to the brain, and this whole process of inflammation, neuroinflammation, can activate seizures. So this is why getting a lot of dietary fiber to prevent leaky gut would be a smart move, whereas high-fat meals, high-fat diets tend to increase leaky gut, and then they increase postprandial endotoxemia. Okay, so I would see that as a problem. Okay, well, this is a little bit more. I already talked about these meds here. That's the thing. You might want to print screen that if you're interested in this. We talked already about sleep deprivation, risk of epileptic seizures. Sleep deprivation does the same thing as acute stress, increasing catecholamines and cortisol. All epileptic seizures have a common characteristic of arising from overexcitation of the brain, and that's what I said. You get overexcitation of the brain from increased cortisol, increased catecholamines. And here they talk a little bit about caffeine, but it was harder to find a paper on caffeine. It could be because it's causing less cortisol and catecholamine release, but it's also because it's a popular commercial product, so they're always trying to defend it and hide it. But here it is. Case reports suggest caffeine triggers seizures in susceptible people. Caffeine can increase seizure susceptibility. In animal studies, caffeine decreased the anti-epileptic potency of some drugs. Preclinical studies say it increases seizure susceptibility, lowers the efficacy of some drugs. So anyways, doesn't sound like a good idea to me. This is another thing from a U.S. pharmacist paper here, and it was saying that these are the drugs that it most commonly associated with causing seizures. We talked about antidepressants, both tricyclics and SSRI antidepressants. Some other medicines, tramadol, INH, theophylline, sedating antihistamines like diphenhydramine. Antimalarial drugs are really bad. I've seen a lot of side effects from those. Some antipsychotics like clozapine. Amphetamines, there's your baseline stimulant, like what they give to attention deficit kids. Great. Cocaine, some systemic steroids, but steroids have paradoxical effects, and they'll lower the amount of edema, the amount of inflammation, and they're even given to prevent seizures, in patients, for example, with brain metastases and whatnot, to decrease cell swelling. So they're a little bit of a tricky conundrum by themselves. There's details and circumstances associated with them, whether or not there's a mass lesion, relative risk. Lead can increase the risk of seizures. Lead's pretty toxic stuff. We talked about how that's more common contaminant than people realize. It's in all sorts of things like turmeric, it's in lipstick, it's in a lot of stuff, in thyme and oregano potentially. Tacrolimus and cyclosporin, immunosuppressants. Okay, here's a little bit about how synapse works with an SSRI, antidepressant, selective serotonin reuptake inhibitor. Normally, the serotonin will be released in the synaptic cleft, binds the postsynaptic receptor, exerts an effect. And then it's taken up, the serotonin from the synaptic cleft, back into the presynaptic neuron through these reuptake transporters. Well, if you block, this is a serotonin reuptake transporter. SSRI blocks the serotonin reuptake so that the serotonin will stay in the cleft for longer. Over time, though, the neurons will compensate. The postsynaptic neuron will just have fewer receptors sent to the plasma membrane, and the presynaptic neuron could increase the number of reuptake transporters. But there it is, serotonin selective reuptake inhibitor to increase the amount of serotonin in the synapse. Now here's some interesting papers. Antidepressant use and risk of epilepsy and seizure. Okay, all antidepressants, all of them increase seizure risk, some more than others. And again, that's why I talked about they're not allowed before a milligram. Risk of epilepsy and seizures was significantly increased for all classes of antidepressant. Okay, selective serotonin reuptake inhibitors and risk of epilepsy after TBI, traumatic brain injury. There was a 5.6 times increased risk of epilepsy if the patient on a SSRI with their TBI. So that's not a good, you can activate your microglia as well from the TBI, and then you're sort of adding fuel to the fire with the SSRI. And like I said, these SSRIs are much worse drugs than people widely realize. So here's fluoxetine, also known as Prozac. Like, there was this incredible irrational exuberance about how great a medicine it was in the late 1980s, early 1900s, 1990s. And as they've learned more about it, now they're recommending it for chemotherapy. This is an oncology journal. Isn't this crazy? Because it's good at causing cell death. And they think it'll potentially be useful to cause cell death in cancer cells. Yeah, well, it's not so great for your mitochondria. It inhibits mitochondria, and it can damage your neurons too. So fluoxetine inhibits oxygen consumption and lowers mitochondrial ATP. Great. Okay, you need that You need that ATP for getting calcium out of the cytoplasm. Great. Okay, fluoroquinolones increase the risk of psychosis and seizures. They're mitochondrial inhibitors as well. That's the antibiotic. Okay, so that's the end of part 3. Hope that was helpful.